Kenya has an estimated 3.5 million new clinical malaria cases and about 10,700 deaths each year. Now, last year, Kenya entered the history books as one of the 3 African countries to pilot and roll out the world's first vaccine against malaria. But is it enough? What will it take for us to completely eradicate the malaria scourge? And that's what we want to find out this evening on Front Row. Good evening. I'm Ashley Mazuri and I'm joined by, of course, I'll start with the ladies. Joy Gakenya, who is the program officer in charge of malaria elimination at the Ministry of Health. Next to me is Anthony Okara, Alma's special ambassador. And of course, last but not least, we have William Decker, who is part of the Kenya Malaria Youth Army. As always, we want you to be part of the conversation, and we ask you tonight, do you think enough is being done to eradicate malaria in the country? Do you think enough is being done to eradicate malaria in the country? You can tweet me directly, I beg your pardon, at Ashley Mazuri at KTN News KE. The hashtag to use is FrontRow. And equally, you can use our SMS line 22155. Before we get to that conversation, I want us to look at this story. Now, Kenya is among 29 countries that account for around 96% of all malaria-related deaths. The women and children are the most affected. This disease spares no one. As Dr. Mercy Korir, our health and science editor, now reports, 2 of Kenya's iconic athletes, Eliud Kipchoge and Faith Kipyegon, almost lost their illustrious careers to malaria.
Eliud Kipchoge, a decorated, celebrated and world-renowned athlete, the current world marathon record holder, a 2-time Olympic gold medalist among many other honors, stands at the top of the world as one of the greatest athletes of all time. But malaria almost stopped his career on its tracks.
Long time when I started actually sports, I qualified for the World Juniors, and it was my first event outside Kenya, but I was not lucky to go there because of malaria. And when we were in training, I'm in Kasaran. I got the malaria, and that was the end of my dreams.
At 37 years of age, Eliud does not take the threat of malaria lightly, especially for an athlete like him, whose health and well-being has a direct impact on one's ability to perform.
The damage it does is crazy, because you feel headache, you are really you feel tired, energy is no longer in the body, and you can't eat, and you know, for a human being to walk around, you need energy, you need to eat, and you need to have a good body and a lot of energy in the body. So malaria actually destroys and takes away all those things in the human body.
I want my daughter to grow in a way that I'm comfortable, that when I sleep, I know that my daughter is safe.
Faith Kipyegon is another world record-breaking athlete. The 2-time Olympic gold medalist recalls how a bout of malaria could have ended the career of this 28-year-old mother of one.
Actually, when I was pregnant, I was sleeping inside under the treated net to prevent mosquitoes. You know, when mosquitoes bite you, and after tomorrow you lost your child, or you die yourself, it's not good.
Africa accounted for 90% of the 241 million cases of malaria reported in 2020 and 95% of the 627,000 deaths. This is 228 million cases of malaria, an increase of 7%, and 602,000 deaths, an increase of 13% from 2019.
Since 2011 or 2012, the incidence of malaria has dropped from 12 to around 6%. So it's essentially on track towards elimination. However, in the region, we begin to see new areas coming up again.
UNICEF estimates that 24 million children in sub-Saharan Africa were infected with the deadliest form of malaria in 2018. A child under the age of 5 dies from malaria every 2 minutes, and these children accounted for 2/3 of all malaria deaths.
I think Kenya in itself, there was a calculation that has been done, we lose about 12 million man-hours a year because of the malaria, I would even say pandemic.
Increased sustainable innovations and investments in malaria prevention, diagnostics and treatment is seen as key in efforts to control and eliminate the disease. Malaria is a preventable and treatable disease, and now the global community is coming together to eradicate this disease. Dr. Masi.
All right, that leads us to our discussion, and I want to reintroduce our guest again. To my immediate left is Anthony Okara, who is the ALMA Special Ambassador. Next to him is Joyga Kenya, Program Officer in charge of malaria elimination at the Ministry of Health. And we equally have William Decker, who is the Kenya Malaria Youth Army. Thank you very much for making time for us. Maybe I'll start with you, Joy. More than around 830,000 children in Ghana, Kenya, Malawi were vaccinated last year. How far are we when it comes to that vaccination pilot?
Okay, thank you and good evening, everyone. Thank you for having us on this show.
You're welcome.
So indeed, malaria vaccine is one of the effective preventive tools that we've deployed in the country to help us in the fight against malaria. As we stand, we were doing it on a roll. We were doing the rolling out of that vaccine in a phased manner. Currently, we got some results which led to a recommendation by WHO that we can upscale in the counties that we had started deploying the vaccine. These are the counties that have high malaria burden. That is the lake endemic counties, about 8 of them. So previously we were doing it in a phased manner, so currently we are upscaling.
What is the efficacy level?
It's above 50%.
Above
so it
50%.
reduces the severity of disease in terms of disease burden and also mortality in children.
Which is a good thing.
Which is a good thing.
Okay,
yes.
all right, coming to you, Ambassador, of course, the fight against malaria has been another success story. But straight to it, and I want to be the devil's advocate in this particular case, we have critics saying we started on a very good trajectory, but somewhere down the line, we sort of plateaued. From your position, where you sit, what do you think?
Thank you very much, Ashley, for having us here this evening.
You're welcome.
A day after we celebrated the World Malaria Day, a very important day in the fight against malaria. We've done pretty well in the last 2 decades in the fight against malaria. Generally, the incidence of malaria is down 35% across the continent, and the deaths, in as much as we are recording, a little higher because of the change in the manner in which WHO was conducting its recording. So the numbers seem to be a bit higher, but on the whole, the trajectory is downwards. In the last 5 years, it has been a bit slower than we hoped to see. We saw a reduction of 1% rather than the 40 that we were targeting, and that is because of many factors. Last year, in the last 2 years, we've had COVID, which had a heavy constraint on the health services, the health system, the workers, everywhere else. So we saw that kind of slow down, but on the whole, we are optimistic. We are positive that we can end malaria by 2030.
All right, so we will get to that and how best we can achieve that. But William, coming to you, of course, Africa continues to carry the burden of the disease. Why do you think it's so? Why Africa?
Well, there are definitely different factors to it, yeah? You look at our continent, the landscape, the geography, but even the kind of environment we have. Look at what are the key transmitting factors for malaria. One of them is the large water bodies we have, and that's why when you mention the statistics at the start, you're finding that it's countries centered around the Great Lakes region. So already those large water bodies definitely is a contributing factor. We share a certain geography with environments that definitely constitute breeding environments. But probably somebody will look at it that malaria is not just an African disease, yeah? It's just that other countries have definitely worked harder to eliminate it. So then it's now our turn as Africa also to work towards eliminating the disease. And that's why now you're seeing all the concerted efforts and a bigger kind of rejuvenized energy towards eliminating this disease burden in our continent.
I like what you've mentioned, that other countries have actually managed to beat this disease. So why is it so hard for us to beat that, Joy?
It's not so hard for us to beat malaria, because I believe the efforts that you're putting in are getting us closer to elimination. So currently as a country, we are targeting the low burden counties. These are majorly the counties within the Mount Kenya region, that is the central counties, the likes of Kirinyaga, Nyandarua, Nyeri, and Laikipia, where we have even a prevalence of less than 1%. That tells you that there is no malaria there. So that is why we are setting up the structures that we would want to start eliminating malaria using. So these are in form of structural, like a surveillance system where we'll be doing case-based surveillance. These are also training the health workers on what they need to do, because eliminating is not the main issue, but sustaining that gain so that you don't have re-establishment of malaria in the regions. So,
of course, I'm sure you're aware. What exactly are these counties doing? Because they seem to be getting it right.
Okay, the countries that have done it, they heightened on surveillance.
Okay.
Surveillance is the key. So that every case that came up, we would be investigating where is this case coming from, which are the probable breeding sites where the mosquitoes are living, and how best can we,
it's okay.
How best can we deploy the prevention tools? So, and when it comes to an elimination setup, we actually deploy and ensure that our protective mechanisms, that is the use of mass cell lion, as well as the vaccine that you're talking about, as well as IRS, that is indoor residual spraying, are on point. Then we come to treatment, we are treating all the cases so that we don't have individuals having some.
We can let you take water before you continue. You wanted to add on that?
Just as she says, look at a country that we benchmark a lot from, Cuba, who already even have their experts in the country. One of the best ways to beat malaria is to eliminate that actual mosquito or the larva itself from the source. And so that's why processes such as
we'll get back to you, William.
Exactly.
All right, we'll get back to you, William, on that. But you mentioned the issue of Cuba, 1973. This is a while back. So here we are, we're talking about surveillance, we're talking about treatment. If you're getting it right in areas like Kirinyaga, why can't we get it right in issues like in areas such as Kisumu, or the Lake region or the Coast region where malaria is really high? Ambassador.
Now, I will throw that to the technical people, but I'll give it a shot. When you map the country, there are areas that are endemic. In other words, there is more prevalence of malaria in those areas than others. So when you introduce the interventions, they may be more effective in less endemic areas than they are in endemic areas. And you can see that the vectors have been changing over the years, so we've had to change our interventions. And I think that is really the issue that we are dealing with at the ministry.
William, maybe I'll take it back to you. You were saying something earlier on.
I was saying, look at the countries that we benchmark from, such as Cuba. And then I bring it back to the actual content of elimination, where you want to fight the disease right from the source. So you want to finish the larva itself before it grows into a mosquito that will transmit malaria. So countries such as Cuba have implemented very excellent strategies such as larviciding, ensuring that at the breeding grounds, there is no more larva that is going to turn into a full-grown mosquito and anopheles that will going to transmit malaria. And you see then that's what the country is trying to do. I remember last year when the president was launching the Kenya Malaria Youth Army, and he was flying the drone that was being used to do larviciding at a pond in Kilifi, and he was telling the young people, now you're going to take up this, because even as we know, when we fight it from the source, definitely we are moving towards elimination agenda that Joy talks so well about, and Ambassador.
All right, and I like the fact that the youth factor was brought into. And, this is a question that all of you were against, but either I have to ask. The issue of campaigns. We are seeing zero malaria. We are seeing youth brought in. It seems to be campaigning after one campaign after one campaign after the other, being released. Are these campaigns really working?
Maybe if I can give a take on that. All these campaigns are aiming at the same thing. The goal is malaria end. We want to end malaria. So they are all supportive tools for us to be able to get there. I like the idea that we have now the youth. They're more youthful, they're more energetic, even they're well spread. They are ready to do the work. Like yesterday when we demonstrated their skills at the commemoration of the World Malaria Day, it was really, they made even the event to really have some life. So why would have so many tools is because we don't have one single tool that we can use to eliminate malaria. So you have to have integration of so many tools. If we come to deploying the preventive tools, we will have to have members sleeping under an LLIN every night. That is a long-lasting treated net. We'll have to also, in the same household, have them do the basic things like cleaning and clearing the bushes around their household so that they can make sure that the mosquitoes don't get somewhere to breed. That is also another tool.
Yeah.
Equally, if there is a child less than 24 months, we'll have to have them go take the vaccine so that at least they boost the immunity and be able to fight this malaria. So all these tools, there's no one fit size that can help us fight malaria. You have to integrate so many efforts, and that integration is what will cause us to get to the target of having a malaria-free region. Yeah.
And I guess that's where integration come in when it comes to integration, because of course there's the issue what she mentioned earlier. There is eradicating malaria, but then there is sustaining that eradication. So then, if we eradicate malaria, which is we're hoping we will, how do we plan to sustain it?
We are confident that we will eradicate malaria over time.
By 2030.
By 2030. So just to add to what Joy was just saying a moment ago, in the fight against malaria, we need all hands on deck. So we need every person, youth at every level committed to it. And the most effective way to reach them is through campaigns.
Okay.
You must do campaigns and more campaigns. In fact, we may have to do even more once we get all the resources we need. Currently, we are operating on less than 40% of our required resources across the continent. So one of the issues we've had is that ineffectiveness in terms of getting to the very end, because you start a campaign, but because you don't reach every corner as you wish, you then don't get the momentum that you're looking for. We have done this even with that minimal resources. So imagine what would happen when we get everybody on deck.
Okay.
And we need to have individual responsibility, which is where we have this important campaign of Zero Malaria starts with me and with you and with every individual. So, and that is critical in this fight.
Zero malaria starts with me and every other individual.
Yes.
Of course, there is knowing that slogan and knowing there's a campaign, but then there's also understanding it. And that's where I guess we seem to be getting wrong. How do we ensure that everyone understands what needs to be done? William?
Thank you. And you've used a very strong word, everyone. Somebody wouldn't look at it as everyone per se like that, yeah? Because then now we segment everybody at a different level. There's somebody at the community level who is the first line, a person we want to reach out to. That you in your household, you have to sleep under a net. You in your household, ensure that there is no breeding ground. So when we let you know that Zero Malaria starts with you, we're actually telling you that take up the right preventive and control activities. When you move to another level, probably implementing at the hospital, at the facility, then we are telling them treat and test. And then you move to another level, now we are coming to key decision makers or program implementers like Joy over here.
Yeah.
Then we are telling them divert the right attention towards the program that can help us eliminate malaria. Then when you come to the decision makers, our leaders who we keep on urging every now and then, we tell them allocate the right resources. Please bring in more commitment and effort, and let us see that you're not only just saying that Zero Malaria starts with you, we can actually attest to the fact that it's starting with you because you put together resources. And I know Ambassador will talk about the President's agenda.
Yeah.
That's one person we've seen that has already shown that he has commitment towards ending malaria through his 4-point agenda. So when everybody says Zero Malaria starts with you, then we cascade it back to you at an individual personal level, that you have to look at what's the little thing that you can do. The same way we say sweep your door and the whole compound becomes clean, yeah? So the whole world becomes clean.
Yeah.
So everybody's sweeping their door. In terms of malaria, is everybody taking up their own single part, and then at the end of the day, malaria gone.
Okay.
Yeah.
And that's a good dream, actually, which can be achievable. But Joy, coming to you, you know, WHO sort of encourages vector control, if I've gotten it right. But then are there more effective ways of handling this disease?
Okay, thank you for that question. So vector control entails several things. It entails creating a barrier between us and the vector so that we don't get the bites. That's where we have the issue about using of nets. So in this regard, as a country, we've done so well. Like in the last year, we've been able to distribute nets to almost 45 million of our population. That is in 29 target counties that we were doing that had high burden of malaria. So when it comes to another strategy that you can use in vector control is that awareness creation, that yes, there is something that they can do, just like William just said. They have a personal responsibility in terms of, we've given you a net, yes, the government has given you a net, yes, but are you sleeping under that net every night, every season? There are those that still have it and they're not using. So our clarion call is that whatever intervention you're selling out to the public, let them uphold and utilize it for us to be able to win this war, because it cannot be won by just placing a net there. They have to sleep under it. When it comes to maybe you've not been able to prevent it and you get a mosquito bite which is infectious and you end up getting malaria disease, do you have the right knowledge that you need to go to the hospital for proper screening using a rapid diagnostic kit or microscopy of where you have a test for malaria, and only those that turn positive are the ones that we give medication, because we also don't want to misuse our drugs and then end up having drug resistance, which will complicate the fight and make us not reach the goal of having a malaria-free world. So when it comes to data, is the data speaking to us as a country? As a country, I will say that yes, we are doing well, because in the last decade, we've seen us half the burden of malaria, from a prevalence of above 10, that is 11.5, to a prevalence of 5.6 nationally. That is in the last KMIS, that is the Kenya Malaria Indicator Survey. So yes, I would say we are making some progress, but still a lot needs to be done. And this could not have been done were it not for the right policies that we have as a program, were it not for the support that we've gotten from even the private sector. We currently have an End Malaria Council that is an extra arm that helps us to fight the malaria disease through providing us with resources and bridging the gap in what we currently have under the Kenya Malaria Strategy. We equally have the president being our champion, is the chair Alma currently, and he has given us a lot of support. Things like the Zero Malaria Strategy, the Malaria Youth Army that you're speaking about, and even the scorecards where we are utilizing it for people to see the malaria situation in their regions. That could not have happened were it not for the leadership, able leadership of the president, who is the current chair. So a lot has been done, but we're still saying the fight still needs to go on, because it will not be won by one single step. We have to integrate and work as a team towards malaria.
Ambassador, coming to you, she said as a country we're doing well, but we can't finish this alone as a country. Absolutely. We need our neighbors. Where do they come in this fight?
Thank you, Ashley. In fact, it's the realization that one country alone cannot effectively and sustain eradication of malaria. That is now a focus on regional cooperation. Excuse me.
Sorry.
Now, in that regard, our approach has been to have the Southern Bloc, the Central Bloc, Eastern, the Horn of Africa, have malaria strategies, collaborate on interventions, have cross-border initiatives, and roll them out. East Africa has taken the lead, and they launched the Great Lakes Malaria Initiative. And in fact, I've gone ahead to have 2 cross-border initiatives launched on the Rwanda-Tanzania border at Rusomo, Kihere, and recently, 2 weeks ago, or was it last week, we launched at the Busia, Uganda, Kenya-Uganda border at Busia. So what this type of collaboration does is to ensure that there is sync in the interventions. When you're having campaigns on either side, that they are synced together. So that, and the sharing of information, when the tracking is being done and monitoring, it's done simultaneously on both sides, and that's more effective. And that is now, if you look at Southern Africa, there was a Windhoek Declaration on malaria. There's a lot of changes in investments in terms of the fight against malaria. And therefore, this regional cooperation is effective, is important, if we're to sustain in the long run. We've been given a good lead by the heads of state. The rest of us must follow now.
It's ensuring that everyone else follows. That's the work.
Absolutely.
Okay, coming to you, William. Of course, if we look at this year's theme, harness innovation to reduce the malaria disease burden and save lives. Of course, looking at the youth perspective, this theme really connects with the youth and the youth army when it comes to fighting malaria. What new initiatives, for lack of a better term, is the youth army coming up with to fight this disease?
I thank you for asking a question that so many people have been trying to ask themselves. We have so many initiatives, and then now we have, boom, the youth again. So what is so new about them? I look at this room, and I could classify everybody as a youth, including Ambassador over here. If he doesn't take any offense around that. But also, just look at continentally. More than 3/4 of our population are the young people. So that means we have the numbers. Besides numbers, you need the voices. We have the voices. And then besides that, to crown it all, you need that energy. There's always what we call the youthful energy that we bring to the table. And that is going to be instrumental. But one more thing that young people are known for as being innovators. So there are traditional ways you want to communicate to the communities. How do the youth innovate to communicate to the communities? If you go to Twitter now, or even LinkedIn, TikTok today, there are lots of videos under the hashtag fight for what counts under the hashtag Zero Malaria Starts With Me. So very innovative ways that you can reach to the community. You can reach to that young person who is at home so that he can tell his mom, don't use this net to fence the kitchen garden away for the chicken. Kitchen garden for the chicken. Yeah, but use it so that we all sleep under the net. So you've reached somebody through a very innovative way. Besides that, the young people, for example, yesterday, in the World Malaria Day celebrations, as Joas mentioned, they moved around 3 counties, traversing Kakamega, Kisumu, and Vihiga, with roadshow and dances. And whenever they get to a market stop, despite the rain, they start the dances, and when everybody comes in, then they start spreading malaria messages. So you find that's another innovative way. It's happening online, but it's also happening offline at the community level.
But then how do you ensure, sorry to cut you short, how do you ensure that this is not just entertainment to them, and once they go back to their homes, back to default mode?
Well, that's why we try to be very, very strategic in the actual messaging. So we pick the messaging from the malaria program and we say, this is what you want to communicate. But if we use this creative way to send it out, then many people are going to take it up positively. We even had plays, young people presenting a drama or skit here and there, some laughs here, but then there's one key important message. But now let me go to the technical component of innovation. Because Ambassador mentioned there's always that regional collaboration, because malaria knows no borders, or the mosquito itself. So our colleagues, even young people continentally, are trying to innovate. If you look at Uganda, we have one of our young person known as Brian Gita. So Brian developed a test kit. I know we already have the one we have from Kemri, but this is a young person, my age, has come up with also another rapid test kit, which also, if it passes all those pre-qualification stages, then it's one that can be implemented. So we want to be innovating on different fronts, whether it's on messaging, whether it's on advocacy, whether it's on treatment, and then the last one is on data. So we want to come in and support other aspects of innovation in that we have our own means of providing the right data. So we go collect data through a mobile app, and then the malaria team can definitely look at it real time and then make decisions out of that. So that's the innovative component that young people bring.
If I may just add very quickly on this. So we have the Africa Youth Advisory Council at the continental level. And what they do is provide a platform where all the youth come and interact on a regular basis. So once you've done this kind of show, you come to this council, you have a target, you have an agenda, you discuss, you find out what you learned and how you can move forward. And they do come with ideas. We are trying to find ways in which you can support those ideas on a regular basis. So they don't roll back to there's pretty much excitement at the youth level, and we're providing the structures to express themselves.
So how do we get this excitement from the youth level to now, for lack of your generation? Because you see, there's also that gap, but we'll be having that conversation after this short break.
KTN News. Get the whole story.